How can therapy help me overcome chronic shame? It's a beautiful sunny morning here in South Cambridgeshire, and I'm shamelessly enjoying the sunshine. And I'm going to talk about helping clients to overcome chronic shame. I define shame as the feeling we get when we feel overly exposed in a bad way. And the action potential is something like, and to have negative automatic thoughts such as, I'm so ashamed of myself. A typical example of a client with complex trauma from childhood and chronic shame might sound something like this. Me and my family were hated by everyone in the street. Mum and dad were always drunk, on drugs, fighting, arguing. Us kids were always in trouble at school. We couldn't control ourselves and were always getting into fights with the other kids and sometimes the teachers. We were dirty and wore old clothes. The other kids were always frightened of us and we were never invited to parties or anything. So I practice as an integrative therapist, which means I integrate the most effective practices from all therapies at the service of my clients' particular difficulties. And I'm explaining how that can work with helping clients with this kind of chronic shame. So treating shame involves a variety of theories and practices drawn from different psychological and therapeutic approaches. And I'm going to describe some of the key theories and practices associated with treating shame. So first up, I'm going to talk about some of the theories. And firstly, Psychoanalytic Theory. So from a Freudian perspective, Freud saw shame as a defense mechanism linked to the superego, arising from feelings of inferiority or failure to meet internalized standards. Another psychoanalytic theory, object relations theory, gives a perspective that emphasizes the role of early relationships and how unresolved issues with primary caregivers can contribute to a pervasive sense of shame. Secondly, attachment theory. And this theory suggests that shame can result from insecure attachment patterns developed in early childhood when caregivers were inconsistent, rejecting, or critical. And children may internalise these experiences, leading to chronic shame. So thirdly, cognitive behavioural therapy. So cognitive behavioural approaches focus on the role of negative thought patterns and beliefs in the development and maintenance of shame. So these approaches seek to identify and challenge distorted cognitions, which may have been true then, but are no longer true now. So humanistic theory, so humanistic approaches such as Carl Rogers' client-centered therapy emphasize the importance of unconditional positive regard, and shame is seen as arising from conditions of worth imposed by others, and therapy aims to foster self-acceptance and self-compassion. So fifthly, social and cultural theories. These theories examine how societal and cultural norms and expectations contribute to feelings of shame. So issues such as stigma, discrimination, and cultural values are explored in understanding and treating shame. So some of the practices, firstly with CBT, cognitive behavioural therapy, a couple of things. Cognitive restructuring can help clients identify and challenge shame-inducing thoughts and beliefs. Behavioural experiments can encourage clients to test out their beliefs and assumptions in real-world situations. Secondly, mindfulness-based approaches. So mindfulness meditation teaches clients to observe their thoughts and feelings non-judgmentally, reducing the impact of shame. Also, the creation of self-compassion can encourage practices that foster kindness and compassion towards oneself. Dialectical Behaviour Therapy, DBT, teaches skills such as emotion regulation skills, which help clients to manage intense emotions associated with shame, and also develop distress tolerance skills, providing tools for coping with the distress that shame can cause. Fourthly, Psychodynamic Therapy allows an exploration of past experiences, focuses on understanding and resolving early experiences that contribute to shame. Transference and Counter Transference also uses the therapeutic relationship to explore and resolve feelings of shame. Fifthly, narrative therapy. So reauthoring stories can help clients to reframe and rewrite their personal narratives to diminish the power of shame. Secondly, externalization allows clients to separate the person from their problem. For example, shame is something one can experience. It isn't an inherent part of oneself. Sixthly, acceptance and commitment therapy, ACT. Acceptance. Acceptance encourages acceptance of negative feelings, including shame, without judgment. And values-based living can help clients identify their core values and commit to actions that align with those values, reducing the impact of shame. 7. Interpersonal therapy, IPT. So interpersonal skills training enhances communication and relationship skills to reduce feelings of shame in social contexts. It also can allow the addressing of interpersonal issues, focusing on resolving interpersonal problems that contribute to shame. 8. Group therapy. So support groups can provide a safe space for individuals to share experiences and receive support, reducing feelings of shame and isolation. Psychoeducational groups can educate clients about shame and coping strategies. So 9, somatic therapies. So body awareness techniques can focus on the physical sensations associated with shame and help clients develop a greater connection to their physical bodies. And trauma-informed approaches can address how trauma contributes to shame and uses techniques to release trauma from the body. So integration and customization in practice. Therapists can often, as I do, integrate multiple approaches to tailor treatment to the individual needs of the client. So this can involve combining, say, for example, CBT techniques with mindfulness practices, exploring past experiences through psychodynamic therapy, and fostering self-compassion through humanistic approaches. So the goal is to create a comprehensive treatment plan that addresses the multifaceted nature of shame. So to help clients to overcome chronic shame. Thank you for watching and have a great day.